Good morning, everyone, and welcome to this session on strategies for catch-up and reducing missed opportunity to vaccination. My name is Laura McLaughlin. I work in the Department of Immunization, Vaccines, Biologicals, and I'm here with my colleague Stephanie. Over to you.
Thanks, Laura. Hi, my name is Stephanie Shendale. I also work in the WHO HQ on the same team as Laura. We're both in the Life Course and Integration team within the Essential Program on Immunization.
So for everyone today, I think what we'd like to present to you is an outline of our presentation. So we're going to discuss the objective of this presentation and describe to you what are missed opportunity for vaccination in terms of how they happen, what is the strategy behind reducing missed opportunities. We provide you a summary of common reasons for missed opportunities as well as findings from recent MOE assessments.
And then we're going to talk about catch-up vaccination. So what do we mean by catch-up vaccination and why it's important? We're going to cover some key system enablers that can be in place to ensure that immunization programs are set up to better deliver catch-up vaccination. And then we'll end talking about a few different types of strategies that can be implemented by programs to provide more opportunities for catch-up vaccination.
So with that, the objective of this presentation is to really emphasize that timely vaccination is incredibly important for ensuring populations are fully protected. And it's very important that we also consider that scheduled vaccinations can be missed for a number of reasons. This can be due to health system, caregiver, or health worker related issues, or as we're currently living in at the moment, these COVID times due to a catastrophic event. But it needs to be clear that no one should miss out on the right to protection that vaccines offer, simply because they didn't either receive the vaccines that they were meant to receive during a visit, or that they were unable to access services in time. And it's really key that we understand that by ensuring that we reduce missed opportunities, provide catch-up vaccination, that this can really help with health system strengthening and closing immunity gaps, which is really something that, particularly in this time, we need to consider strongly, because we know that many people have missed out on many of these life-saving interventions during this period of lockdown and service disruptions. So no one should miss out on the right, and we need to think about strategies to ensure that when people do access our services, that they get the interventions that they need. So when we talk about what is a missed opportunity for vaccination, what we're talking about here is any contact by an individual who is eligible for vaccination, which does not result in the person receiving all vaccine doses for which they were due. And when we talk about this, we're talking about people who are within our services, who are accessing our services. What we're not talking about are missed populations, people in hard to reach areas, or people who don't access our services for a multitude of reasons. But what we want to try and think about is when we have people visiting our services, how can we make the most of that contact in order to ensure that that person is fully up to date and they've fully protected against all vaccine preventable diseases. And also we need to think about not just thinking about immunization, but also we need to think about other health interventions that are important. So the missed opportunities is something that has been around since the late 1980s. And in 2015, our team were tasked with reviving the missed opportunities vaccination strategy to really try and bring it more up to challenges that we could face in the current decade. So I think what we have produced over the past number of years are a set of guidance documents, which can enable countries to plan and prepare for implementing the missed opportunities of vaccination strategy. So countries may not be fully aware of the extent of missed opportunities within their country. So this planning guide and also methodology guide provides countries with the opportunity to carry out country level assessments and really try to determine what are the root causes of many of these missed opportunities of vaccination. However, in the intervention guide, which is the key document really, because this allows countries to determine how they can implement and monitor interventions to reduce missed opportunities for vaccination. Within this guidance document, we actually provide some options to countries whereby they can make better use of available data by looking at some key issues that are leading to missed opportunities and therefore implement interventions, or they can incorporate missed opportunity vaccination related questions into other ongoing assessments. And then finally, how they can really make sure that they incorporate any of these activities that led to increasing coverage, try and incorporate these into long-term health system improvement plans to ensure sustainability. So as part of this strategy, we emphasize the importance of collecting both quantitative and qualitative data and trying to triangulate this information to try and determine what are the most important interventions that would be relevant for the country context in order to reduce missed opportunities for vaccination. So here's a summary of some of the common reasons that we've identified for MOV. And I think it's important to emphasize that many of these are interrelated. So we have caregiver, health system, and health worker related issues that lead to missed opportunities. And some key things that have emerged from a number of assessments is that related to caregivers, the low home-based record retention or not bringing the home-based record to every health facility visit is a critical issue with missed opportunity vaccination, because without this document, health workers are not able to screen the status of the individual to see if they're eligible for vaccination. So what we find is that this document is very, very important. However, I think there's more emphasis needed to be placed on the importance of retaining this document and bringing it to every health contact. Also, many caregivers are not fully aware of the schedule because I suppose there are certain contact points, or they're not sure what to do when they do miss a certain contact point. So this again emphasizes the importance of the home-based record, because within that it should inform the caregiver about when to come for the next visit, but also let them know that which vaccines their child has received. Also, vaccine hesitancy sometimes can be observed amongst caregivers, whereby they sometimes have questions or are unclear about some of the benefits of vaccination. So when we look at health systems, we see that there's sometimes often limited hours whereby they're not convenient for many caregivers to come to bring their children for vaccination, or that maybe people have to wait a long time for vaccination, and therefore it often leads to people having to either come back another time. So that is a very unfortunate use of time for many people, and it leads to also a decrease in demand ultimately in many settings. We also have issues with shortage and stock out of vaccines and our home-based records, lack of system integration between different health programs, poorly designed records for recording and reporting vaccines, other adverse policies, and then of course there's restrictive policies on age limits, which is something that Stephanie will mention later. But when we look at health system and caregivers issues, there's certainly many of these issues lead to missed opportunities, and also are stumbling blocks in terms of when children are determined whether they're eligible or not for vaccination. And this very much coincides with some of the health worker related issues, which look at, which have identified some health workers have failure to screen children during health facility visits, determine false contraindications. So if a child has a mild fever, a health worker may determine that the child is not eligible. And then there's also concern around catch-up schedules and eligibility and wastage. So taking this all in together, you can see that there are a multitude of common reasons for missed opportunities, but some of these can be fixed quite easily. And I think one of the key things is this catch-up policy, which Stephanie will describe in detail later. So when we look at the findings from some missed opportunity vaccination assessments, I've highlighted some of the published findings that have come out in the past 2 to 3 years related to the recent country level assessments that have been carried out. We see that this issue with lack of system integration really comes out strong, because we see that when children are brought to health facilities for either a medical consultation, accompanying a caregiver, or for a healthy child visit, that many of these children leave without receiving vaccine for which they're actually due. The numbers are quite high. You can see the proportions ranging from 77% upwards to even 100% in many countries. Really identifies that in order to have proper system efficiencies and proper mechanisms in place, it's important that countries identify the children that are coming to their health facilities, that they screen these children and refer them for vaccination. Because if this is going to continue, we're going to see a lot of children who potentially were eligible on the day but were missed, and then this is going to lead to potential increased susceptibility to infection if they're not caught soon or caught up on those vaccines. And then it's also important to note that, I think people are often surprised, is that during a vaccination visit, many children actually have missed opportunities for vaccination. And we see that in Kenya, as many as 1 in 5 children with have missed opportunities, whereby Chad has as many as 1 in 2 children experience a missed opportunity for vaccination during a vaccination visit. And the reasons for these are manyfold, and some of them were discussed during the common reasons for MOV. But what we find is sometimes it could be due to wastage, feared wastage, whereby the health worker does not want to open a new vial for the child who's there. It could be due to stock out, that there are not enough vaccines available or other related supplies to administer the vaccination. It could also be due to the false contraindications, whereby the health worker deemed the child was not eligible for vaccination on that day. And also it could be due to the issue with determining eligibility and having these restrictive upper age limits for certain vaccines, so whereby a child may have missed out on a vaccine in the past, and when they return to the health facility, the health worker is not able to determine if that child is eligible or not. So I think what we're seeing here is that there are many, many reasons why there are missed opportunities for vaccination, but I'm going to pass this over to Stephanie now, who's going to outline some of the main ways that we can think about catch-up vaccination and how this can lead to improving coverage.
Thanks, Laura. So when we talk about catch-up vaccination, in this context in particular, what are we really talking about? And so as Laura discussed in the first half of this presentation, there are many, many reasons why individuals might not access or be able to get vaccinated on time. And catch-up vaccination is really just referring to the ability to offer that vaccination to that individual at a later date. And this is not a new problem. This is clearly a problem that's persistent in many immunization programs across the world, and has been so for a long time. And so what we really want to stress is that providing these catch-up vaccination opportunities should really be an essential and ongoing part of all immunization programs. As I said, it's not a new problem, and it's also not really a new recommendation either. The catch-up vaccination is a WHO recommendation that's embedded in a lot of the other routine immunization strategies that a lot of you may already be familiar with. Obviously the MOV strategy, as Laura's been talking about, but also catch-up vaccination is an essential part of the second year of life platform, for example, offering catch-up opportunities to children in the second year of life for any antigens they might have missed in the previous year. The recommendation to implement daycare and school vaccination checks, for example, that is essentially introducing another opportunity for catch-up vaccination. And so this isn't anything new, but of course now, unfortunately, as we're seeing that COVID-19 is causing a lot of system interruptions to immunization programs all over the world, there's an enhanced sort of recognition of the importance of catch-up vaccination and the importance of having system enablers in place to allow immunization programs to vaccinate individuals late. And so if you're not already doing this, if a country doesn't already have an established catch-up policy in place, now is definitely the time to start thinking about it, because it's going to become increasingly important as we unfortunately see interruptions due to COVID that might persist for some time in the future. Next slide, please. So in order to help countries to establish or strengthen existing catch-up vaccination policies, WHO has recently published some new guidance. It can be found at the URL there on the screen. And this guidance is split into two sections. So the first section covers some key principles of catch-up vaccination and changes to the immunization program that can be made to better enable systems to be able to deliver late vaccination across all aspects of the immunization program. And as I said, as part of ongoing routine immunization service delivery. The second half of the guidance focuses more on situations such as right now with COVID-19, where there might be a more systemic interruption in immunization service delivery. And this is, possible to come up not only as a result of a pandemic situation, but we might see these types of interruptions due to natural disasters, conflict situations, population migration, and it could, continue to happen in the future. And so the second half of this guidance talks about some ways that immunization systems can be designed so that they're more resilient to these types of interruptions, and some additional specialized strategies that might need to be put into place to deal with larger groups of unimmunized individuals as a result of an interruption in services. Next slide, please. So the first half of the guidance, as I mentioned, talks about sort of some key system enablers across all aspects of the immunization program that can be put into place to better allow for catch-up vaccination to occur. Unfortunately, we don't have a lot of time in this presentation to go through all of these in great detail. So I really do encourage you to go check out the guidance where a lot of these things are described in more detail. But some of the top sort of important ones that I just want to highlight today are listed here. So of course, obviously, first and foremost, there needs to be a catch-up policy and schedule in place in the country. And then of course, there has to be the appropriate health worker knowledge and training to be able to actually implement the catch-up vaccination policy and schedule. And this is a really important piece. As Laura mentioned in some of the causes of MOV, poorly designed data information systems can really have an impact on individuals being able to get the vaccinations that they're due. And this comes up a lot for catch-up vaccination because recording and reporting of late doses is not something that all immunization data information systems are currently designed to capture. And this can cause a lot of problems if you have to be delivering late doses and don't have the appropriate tools in place to capture those doses. Of course, communication is very, very important. It's always the main message is to, come for your vaccinations on time. We of course want to encourage individuals to get vaccinated on time as per the schedule, get protected as early as possible. But given that we know there are lots of reasons why that might not happen, we also want to make sure we're delivering the message that it's not necessarily too late. And just because you've missed out on a vaccine appointment, people shouldn't feel that they're automatically no longer eligible for that vaccination. So communication on this is very, very important. And then of course, the strategies themselves for implementing catch-up vaccination and making sure that there are multiple opportunities for individuals to still get the vaccines that they might have missed. Next slide, please. So a catch-up policy really needs to provide clarity, particularly to the service delivery providers in the country, on how to actually do this, how to actually provide this catch-up vaccination. And so of course it should emphasize the importance that if an individual misses out on their doses, they still need to have an opportunity to get that dose at a later date, and it's not necessarily too late. And the guidance also needs to provide clarity on how to determine the eligibility for late catch-up, and particularly what to do if a vaccination history cannot be ascertained. So Laura mentioned a lot about the importance of home-based records, and this is a really key tool to allow both health workers and individuals to know about their immunization history and which vaccines they're still due. But we also know that home-based records, chronic stockouts of home-based records are a problem in a lot of places, and retention is not as optimal as we'd like in many places. And so there will be situations where there isn't a record available to allow the health worker to know necessarily if an individual has received previous vaccination. And so the policy and guidance in the country needs to provide clarity to that health worker on what to do in these situations so they're not forced to improvise their own solutions. Similarly, as I mentioned earlier, the correct reporting and reporting of delayed doses, how that's to be done, that needs to be very clear in the guidance so that health workers don't have to make things up and figure out where to write down that they've given a dose that's later than the target age. And then of course, reinforcing the key concept that's so central to the MOV strategy that Laura mentioned before is just leveraging every health contact as an opportunity to review the immunization status and offer vaccination or refer to the vaccination clinic whenever possible, because especially given that a lot of people have missed out on their appointments in the recent months due to the pandemic, making sure that those individuals are caught up through any opportunity that they possibly can be anytime they come to a health center is going to go a long way in trying to close some of those immunization gaps that have been created. Next slide. So WHO actually has already, and has for a long time now, had published recommendations for delayed or interrupted immunization schedules. And this can be found with the link on this slide right there. This is essentially a summary of all the different vaccine position papers that WHO publishes for all of the antigens. And this just pulls together in one place all of the recommendations from those different position papers, so that when policymakers, decision makers in countries are designing their policies and their immunization schedules, they have all these recommendations in one place. And so the importance of designing a catch-up schedule so that a health worker knows what to do when an individual comes for vaccination late is really important. But this is not a catch-up schedule in and of itself. This is simply a consolidation of recommendations that needs to be interpreted and developed into a catch-up schedule that's based on that individual country's immunization schedule. But a catch-up schedule in the country needs to really clarify a few key things for health workers, specifically the ages to what it applies, because now that we know that life course vaccination is becoming more and more important and taken up by more and more immunization programs, you are going to have immunization catch-up schedules for different age groups as a result. And so you might have to have one catch-up schedule for children under the age of 2, another catch-up schedule for older children, another one for adolescents, another one for adults. And so these recommendations can help decision makers and policymakers to develop their schedules. Next slide, please. But a policy and a schedule even is only good insofar as that a health worker actually knows how to interpret it and offer that catch-up vaccination. So it's very important to make sure that the appropriate training and supervision is provided to health workers to be able to interpret these policies and schedules. And in some cases, this actually might require a real shift in attitudes and practices. We know that immunization programs historically have really been focused mostly on infants, and so under the age of 1. Now that's changing. We have the second year of life vaccines, and we have boosters in older children, adolescent vaccination, adult vaccination. This is changing, but the concept that once you're 12 months or once you're 24 months, you're too old for vaccination is still persistent in a lot of places. And so if this isn't already a practice in the country to be able to vaccinate late, this might require unpacking some very ingrained attitudes with health workers. And so this should be considered in offering the training and supportive supervision to change these attitudes and implement these newer practices in some places. The key message is really to reinforce that for most vaccines, it's better to vaccinate late than never. And so this should really be a central message throughout. And we also, again, want to reinforce the practice of checking the vaccine status at every contact. And this also means reinforcing the message to caregivers and individuals to bring their home-based records at every visit so that this vaccination status can be checked. And these types of things, as I mentioned, really need to be strengthened through supportive supervision, but job aids can be helpful as well. And we have some examples of different job aids that can be adapted into different country settings, and those are available online as well. Next slide. So I mentioned earlier the importance of having data information systems that are set up to enable the system to capture these late doses. And this can really be a challenge in a lot of places because where tools are currently designed to capture vaccination in very discrete age buckets, this inadvertently sends a message that if you don't get vaccinated within that age range, then you're no longer able to get vaccinated at all. And it really can lead to unintended consequences like people being turned away because the health worker is faced with a situation where he or she doesn't have a space to record giving that dose on the data tools. And then they're forced to make a decision on their own of whether they should give a dose and not be able to record it, in which case it might get included in wastage, or to not give the dose at all. And we, again, want to avoid putting health workers in the position where they have to make up these decisions on their own. And so having data tools that really allow for somewhere, anywhere where these types of late doses can be recorded will also send the message that that's okay to vaccinate late. And this applies to the tally sheets and monthly reports as well. And then, of course, to the home-based records themselves and immunization registers. It's very important that there's a place to provide recording of all doses that are given, even if late, so that that record is maintained for the next time that the individual comes back to the health center. So the actual strategies for catch-up, these are all the different ways that an immunization program can essentially provide additional opportunities for vaccination if the scheduled appointment is missed. And as I said earlier, a lot of these things already are embedded in a lot of routine programs and should be a part of routine immunization programs going forward. This isn't only because you have an interruption in services and then you're, having to deal with a large gap. These are just opportunities to catch individuals who, for any reason at any time, might miss their vaccination. So we've said a million times, clearly it's a theme of this presentation, reviewing the vaccination history every time an individual comes to the health center, whether it's for another immunization visit, whether it's for a curative health appointment, for any reason whatsoever. Implementing practices of reviewing that history at all times will offer the opportunity for anyone to be caught up if they haven't already received the vaccine that they're due. Newborn and defaulter tracking, this is a recommended practice that's in place for a lot of countries, but that's also an opportunity to sort of get individuals back if they've missed out on the doses. Daycare and school vaccination checks, this is really an opportunity for catch-up, gives children the option of or the ability to be caught up on any vaccines that they've missed prior to that age point. And some countries already routinely implement peer activities on a periodic basis to offer catch-up vaccination to certain populations, groups, or target ages that may have missed out on any of the doses that they need up to that certain point. And then, of course, following an interruption in services, when you're dealing with a larger number of unimmunized individuals, this might require additional strategies on top of all those other things in the green side of the screen. And because of the COVID-19 interruptions, we have a lot of countries that are in this situation right now where they're trying to decide what additional strategies they can put into place to offer catch-up vaccination to larger groups that might have missed out on the vaccines during the last few months of service interruption. So this could include massive callback efforts like large communications campaigns, which encourage people to come back in and really stress the message that just because you've missed your appointment, it's not too late. It's still important to come get vaccinated. Intensify defaulter tracking, so line listing of anybody who was supposed to have come in during those months, offering expanded and modified outreach, so maybe widening the age ranges to anybody who should have been vaccinated during that window. And then, of course, if there are really large numbers of unimmunized individuals, and particularly for vaccine-preventable diseases that are at risk of an outbreak, there's, of course, a consideration of doing an SIA, where you just can really target a large group of people in a short amount of time and vaccinate them with one or more antigens. Next slide. And so because of the situation that a lot of programs are finding themselves in right now, where services have been interrupted because of COVID, but are also still operating in the context of an ongoing pandemic, this changes the game a little bit, and there are some additional considerations that need to be put into place. And so to help with this, we've also put together a resource that's available on the same website as the catch-up guidance that frames a lot of these concepts and considerations, but in the context of COVID, and some additional considerations that need to be layered on top of it all while countries are still trying to provide services in a safe environment with additional considerations that additional challenges, that COVID is placing on them. And so this PowerPoint is available to bring some of these concepts together in one place. Next slide, please. And so that, I know we whipped through a lot of things in a really short amount of time, but more information is available at these links. And of course, we're happy to answer any questions or follow up that's needed, but that's it for now.
Thanks everyone for your attention.